Go.
Hi, I'm Mark.
And I'm Victoria.
Today we're going to chat about one of our favourite treatment modalities, and that's foot mobilising therapy, or FMT for short. So Victoria, what is foot mobilising?
Foot mobilising is where we gently mobilise the joints in the foot with our hands, and that just increases the movement between the joints and helps release any soft tissue structures around them.
And is it painful?
No, patients often enjoy the experience.
So they can walk afterwards?
Yes, and they usually walk better because their joint function is improved.
So how do joints become restricted in the first place?
So it can be an altered movement or a bad habit like sitting for too long. It can be poor biomechanics or just something that they're doing with their running style. It's not quite right for their joints.
Yeah, and sometimes it's the result of restrictions somewhere else in the body as well. So what does foot mobilising achieve?
So mostly it increases the joint fluid between the joints, and that in itself increases the mobility between the joints, improves the movement, and it has a big effect on pain and restriction, particularly with arthritic joints that haven't quite been moving very much.
Yeah, and another example that springs to mind is if people have restrictions in the feet, one of the compensations is often to lean forward a bit to try and get past that blockage, and then they start developing low back pain. So releasing the joints in the feet, surprisingly, can help with that. So how does foot mobilising fit into our treatment approach?
So we use a lot of different modalities in our treatment approaches. Those include plantar massage, dry needling, orthotic therapy, possibly shockwave therapy, as well as mobilising the joints and looking at some exercise rehab programs as well.
Yeah. So say someone came to us with heel pain and we diagnosed them with plantar fasciitis, for instance, how would we treat that?
So yeah, with plantar fasciitis, orthotic therapy is a big one for helping improve the biomechanics of the foot. We'd possibly look at some plantar fascial massages, definitely do FMT, maybe some shockwave therapy, dry needling and stretching, and then we'd also prescribe some rehab exercises to help improve their foot strength.
It's a pretty comprehensive approach, isn't it? It really helps us get good results. Well, thanks Victoria, and we'll see you in the next video.